Hi, my name is Mary Jo Turk, and I'm a researcher here at Dartmouth Geisel School of Medicine, and I'm a cancer researcher. My focus has always been how the immune system responds to cancer. So our immune system that we all have, ways to make it respond better to cancer. And I've been working on this since 2001, and more specifically, I've been working on the disease melanoma, which is a deadly skin cancer. Working in melanoma became personal to me in 2009 when I lost my aunt, my dear aunt, who was very close with me, to the disease. And I'll say in 2009 there really wasn't much for melanoma patients. It was very little that could be done to help patients with this very deadly disease. I witnessed that firsthand.
My name's Christina Angeles. I am a surgical oncologist at Dartmouth Hitchcock Medical Center and part of Norris Cotton Cancer Center. And during my training, I took care of a lot of different cancer patients and really focused on being the best technical surgeon I could be to really try to, cure patients. And as I realized through training, more and more patients I was seeing that were having recurrences of their cancer. We can give them the best surgery, for early disease, and they would recur. And especially my melanoma patients. Melanoma is one of the types of cancer that I treat. And I would have young patients that would have, melanoma skin cancer, and then we would treat them, and then within a year or 2 years, it would come back. And at that time, it would be spread, and we would have to tell them their chance of cure was likely zero, and we really didn't have any treatments to help them. In 2011, there was a breakthrough, and we had the first FDA approval of a type of immunotherapy that could boost their own immune system. So this was a really exciting time, but we only saw about 30% of patients had a response. Okay, so most patients really weren't responding. But it was so interesting, because what about the patients that were responding? What was different about their immune system that they were responding and having a prolonged, actually, effect in terms of that it wouldn't come back? If they had a response, it was long-lived. So there's something special about their immune system. And that was really interesting to me. So I knew that I had to do research, because just being a surgeon was not helping these patients.
So we met, and what I explained to Christina at the time was that our research was very well aligned, and we were finding in the laboratory, so I'm an immunologist, and we are trying to treat mice with melanoma. And what we were finding was a group of mice that had these durable responses as what Christina saw in her patients. And that was becoming our focus in understanding how can you get a durable immune response against cancer, in this case melanoma. And what we discovered in the lab, and we published this just last year, is that these mice with durable responses have a unique immune cell population called a T cell. And we've known for several years now that T cells are really important at fighting cancer, because they can directly recognize and kill cancer cells. And they can do that very specifically. And what we found out about these mice that were long-term survivors is that they had a unique type of T cell called a memory T cell. And we call these cells memory T cells because they live a long time and they remember the tumor. And we found that these mice had memory T cells that went into their skin, which, remember, is where melanoma arises. And the cells lived there for a long time, months, over a year now we've seen in mice, which is a long time for a mouse. And we found that these cells in the skin, these memory T cells, were protecting the mice long term. So we were really excited this, and I shared these findings with Christina.
And I said, well, I wonder if our patients have these cells as well. It's never been described in humans. This was the first time it was described in an animal model. And so I reached out with my colleagues, some of these long-term melanoma survivors, and said, would they be willing to be part of a clinical trial? And we designed a clinical trial. It's been open now for a little over a year and a half, and some of our long-term melanoma survivors they're very excited to take part in this because they want to help others as well. And we have really exciting preliminary results in our patients that we have so far. We're actually 5, they do have these cells. So it's the first time it's been described, and we are really excited about this because it's those same memory T cells specific for against melanoma that are in the skin. Now this is just the beginning, right? So we've just, we need to get more patients to see if we're seeing this in all different subsets of patients that are having responses. But we are excited about these findings, and we think that we can have some potentially future research that can really help our patients.
Yeah, so what do we need now? Where are we going now? That's the big question. Well, we need an investment. We need funding for this research to move it ahead. We've been successful in gaining some funding from the National Institutes of Health recently. We really want to drive this, though, more on the human side, and specifically two main things. One is to do the research to understand what immunotherapies give this type of a response. Because again, there are those patients that aren't responding, and those are the patients we want to understand. How can we change immunotherapy so that they will get these memory T cells where they need to be? And then the second is to even a little bit more ambitiously engineer these cells in the laboratory so that we can give them to patients. And we know that they're going to go in melanoma patients to the skin and be there for years, ideally, that this population can provide this protection. And we envision this as not only for melanoma, but the concept should be more widely applicable as well to going to other organs for other types of cancer as well.
Exactly. We really envision that if we get the funding to be able to do this, that we could significantly increase the amount of patients that we can have a durable, long-lived protection against their cancer, not just melanoma, as Mary Jo said. And I think that, you know, right now there's been a lot of improvements in immunotherapy. I know that we see it on the TV, on the screens, but we're still only having an effect in about 50% of patients, but durable only about 10% of patients. So we really do need more advancements. And I think the new avenue that we're really exploring, that's new, it's innovative. I think if we can do this, we can really have promising treatments for our patients in the future.
Thank you both for that presentation. This is really exciting research. One thing that pops into mind is, as you're talking about the memory T cells, is there in your preliminary research any indication that there's, if I have melanoma in my hand, for example, what happens if I have melanoma in another area of my skin? Do those memory T cells actually work for a specific area, or is it limited to where the first diagnosis was?
This is such a great question. Yeah, we're addressing this in the lab, and we have some answers on this. It appears from our model, again in the laboratory, that this is, first of all, the skin memory T cells are skin wide. And it wouldn't matter where the tumor was, that it should be a skin wide protection. But even beyond that, for a disease like melanoma and all cancers, metastasis is the biggest problem. We know melanoma metastasizes to lung, to liver, other organs as well. In our mouse model of melanoma, we don't understand how it's happening, but the mice also generate these cells in other organs, including lung and liver, which is really exciting. We're hoping to publish that soon. And if that's true, then this is really, truly tissue-wide, host-wide protection against cancer, which is so exciting to us.
Exactly. In our human studies so far, the cells that we've identified are not at the site of where the melanoma was, but in other areas of the body. We haven't looked at other tissues yet, but that's our plan, next steps.
Very exciting
Very
research.
exciting.
So my question for you is, you talked about the clinical trial going on now, and it's been going on for about 18 months. So how large is that clinical trial? How many patients are you involving in that clinical trial? And also, would you then think about expanding the clinical trials to other kinds of cancers? I'm just curious about that. So would it be more Dartmouth-Hitchcock focused, or are you thinking a bigger clinical trial which would be beyond our area?
Sure. So far we have funding for about 30 patients, and that includes melanoma patients with the response and also some normal controls as well. So we need to start with that to get more data to show hopefully a significance so that we can, do more. just like we talked about in terms of other organs and other cancers, the next step is, of course, going out to our colleagues here at Dartmouth to do other cancer types. There are others, such as lung cancer, where they're using immunotherapies as well, and patients finding a response would be very interesting to compare it to that. And our hope would be to expand to other institutions, other cancer centers, in terms of collaborative work with other cancer centers as well.
Wonderful. Well, thank you so much, both of you, for a wonderful presentation. It was very helpful to understand a little bit more about your research. It's a wonderful project, and we wish you the best of luck and appreciate your time today.
Thank you
so much. Thank you.
you.